I think a good point, and part of what really surprised me in your book, and this is one of the things that we're big on, the loss of nitric oxide as you age in a perfect world, but we live in a modern world. We live in a modern world where toxins are a factor. The location of where the vegetables are grown is a factor. The soil, the content. So I know that you did you actually tested this. You went through many different states, bought vegetables in many different states, because there's an actual dose that you can get from food that will be sufficient for nitric oxide production, right? But then you tested different states, and the dose that you got was, a tiny amount, even eating a horrendous amount of vegetables. Is that correct?
Yeah, so the question was, and as a scientist, I like to ask practical questions, right? How do we take a complex science and put it in a simple, practical way for patients?
That's what we're in the business of doing.
So when you understand what this looks like, and this isn't a surprise, the food that we grow and eat in America over the past 70 years, since the 1940s, there's an 80% reduction in trace minerals and nutrients.
Yes.
So it's just the pressures of feeding a growing population has that been at the expense of nutrient density.
Right.
And so we're missing a lot of nutrients in the foods we eat. So that's why we have to supplement things like selenium, chromium, these trace minerals that we're missing from the foods that we're eating.